right, welcome back. I'm your host, Michael Stamatinos with the Advancing Healthcare Innovation Show. And if you're new to us, we're very, very excited to have you here. We happen to be very passionate around healthcare innovation and adoption, things like access and leadership that matter, moving the needle forward, creating better outcomes for patients. And if this is your first time tuning in, let me just kind of tell you a little bit about what we're doing here. So we're a healthcare innovation company, and what we're doing is we're focused on bringing real stories of innovation within healthcare to life. And our aim is focusing on real people that are in the trenches, doing the work and sharing those stories and bringing them to light. We've got an incredibly action-packed year with some amazing content and incredible interviews that are lined up. And if you haven't listened to any of the previous episodes before, press pause here, hit the subscribe button now, and make sure that any of the new interviews come right directly in your inbox. And as mentioned, really excited today to have our next guest on, Chris Malone, who's the founder of Fidelium Health. Chris, welcome to the show.
Thanks very much, Michael. Pleasure to be here.
Yeah. So, there's been a lot of talk just around leadership and experience and consumer engagement. I'd love, before we dig in, to maybe have you spend a minute or two on your background and the relevancy of how you kind of came about formulating Fidelium and the problems that you guys are focused on and solving.
Terrific. Thank you. Well, actually, I've spent most of my career in sales and marketing roles for larger companies. Procter & Gamble, Coca-Cola, went on to become chief marketing officer at Aramark Corporation and Choice Hotels International. But it was in about 2009, 2010 that I stumbled across some work coming out of academia, social psychology work that really inspired me to kind of step away from the corporate world and start my own firm and write a book, actually, called The Human Brand, which is on the psychology of human trust and loyalty, particularly in a customer context. And then over the last several years, we've shifted over and applied that in the context of healthcare as well. And so it's been quite an unexpected and circuitous journey, I guess you'd say.
Yeah. So, there's been a lot of interesting changes that have happened over the course of the last 36 months. Give us a little bit of a snapshot of some of the problems that you guys are keenly focused in on right now.
Yeah, of course. And, these were problems that existed before the pandemic, but the pandemic just kind of was the tipping point to kind of push them over the edge. And these are issues that we saw not just in healthcare, we saw in other places as well. If you kind of look over the last decade, loyalty and job engagement in most industries has been steadily declining as we have more and more digital interactions with one another. And, part of what is driving that is we are wired by evolution to have most of our experiences face-to-face. And, the psychological process that we use to perceive, interact, and form relationships with one another, hasn't changed in thousands of years and isn't going to change in our lifetime. But technology has really been disrupting that to a great degree. So now you introduce the pandemic, right? And now it's like virtual digital on steroids, because not only are we doing things with mobile devices and social networks and e-commerce, but now we're not even physically going to the office in many cases. And particularly in the context of healthcare, it has created kind of a perfect storm of challenges, right? That volume of patients into acute care facilities overwhelmed the system, really burned out a lot of frontline caregivers. So we're now 20% of nurse roles are vacant, and we're struggling to try to do care the same way with 20% fewer people. And as a result, that's having an impact on patient safety, patient care levels, patient outcomes, and all of that rolls up into patient experience. And then, oh, by the way, trying to fill the gap in staffing, costs have gone up dramatically for temporary help and other supplies and so forth. And so the pressure, is really terrific. And I believe that it really requires us now more than ever to fundamentally change the way we deliver care. We don't have the luxury of waiting any longer. The pandemic has kind of burned the bridge to the past. We're going to have to forge a new future.
So how have you guys helped facilitate? How are you bridging the gap between what needs to happen in the digital transformation that I guess people want to happen? Where is that gap? Where are you guys the glue in that situation?
Yeah. And it's not that the digital transformation is bad. We just have to adapt the way we do things to make sure that our brains and our relationships continue to remain strong, right? We can't use the old ways with the new digital tools. And so the way that we are helping, and I think this is one of the ways, it's an opportunity for lots of innovation in healthcare. As advanced as healthcare is in adopting technology and biological and science on the physical side of things to deliver better clinical care, I believe healthcare has been rather slow and is behind the curve on adapting things we have learned in social science. So for example, how to build, lasting culture and employee engagement and caregiver engagement and what matters to patients, right? I think healthcare tends to take kind of a clinical, rational approach to things that from a patient perspective are very emotional, social, and psychological, essentially. And so that's really where the gap is. And the way that we are filling that gap is we are bringing this insight from social psychology that has been validated kind of across the world over the last 20 years of how we perceive, interact, and form relationships with one another, and applying that to the design and delivery of care experiences so that we can fill that emotional, social, empathy kind of care gap, if you will, and kind of marry it with the technological, clinical, medical side of things. So I'll kind of pause there. I know I've kind of been rattling.
Yeah, I was going to say, so walk through a use case.
Yeah.
Walk through a use case, because I can only imagine that, look, there within healthcare, and this, especially within health systems and even within payers, there is a sea of data, and sometimes they can't be. How do you kind of cut through that level of confusion and actually give them insights that are actionable, that they can actually take action on, that gets them the outcomes that they want, which is reduction in burnout and just an improvement in engagement as far as the workforce is concerned?
Yeah. And so one of our clients during the peak of the pandemic, we could see that the pain was concentrated, very much so in the emergency department and in inpatient acute care. And one of the things we identified, of course, as everyone knows, is the wait time associated with the emergency department when they're overwhelmed and staff is short. There wasn't a lot that could be done in a short term to change the speed at which people were cared for and the throughput. However, we recognized that it wasn't just the speed of it, it was how people felt and what they knew about what was going on. And so our client saw the opportunity with our advice to create kind of hospitality ambassadors in the emergency department. These are non-clinical people that went into the emergency waiting area, provided beverages, provided blankets, provided physical and emotional comfort, explained to people the process that determines who gets served first, right? Those who are sicker need to get treated sooner. If your condition is not life-threatening, you might wait a little longer. Most people don't completely understand that. And so kind of more keeping this dialogue going and providing some hospitality, if you will, in the emergency department significantly improved how people felt about the time that they waited. And so it was the kind of thing that wasn't able to physically change the limitations of what could be done medically, but made people feel a lot better about that experience and felt like people cared about them. They knew what was going on. Whereas if we don't really know what's going on, our brains have a tendency to kind of fill in the gaps with the worst possible scenario and make the worst assumptions about what people's intentions are or what's going on.
It sounds like then what you did there is you allowed them to create a process to reach people on a human level and deliver tactical empathy, which doesn't sound so innovative, yet it's very basic. And sometimes we're missing the basics. We're shooting for the moon. Do you find that often where people are looking at, to craft the tricks of the trade, but they haven't necessarily learned the trade?
I think at times we make things more complicated than they need to be, right? And there are a lot of things about healthcare that are complex. The medical, biological processes are genuinely complex. However, kind of the social, emotional, and relational side of interacting with people is not nearly that complex. And it's not really helpful to try to reduce it to a flow chart or a checklist or a series of if-then statements or what have you. The world-class organizations we've worked with, like Chick-fil-A and Starbucks and others, the way that they deliver a really consistently great experience and able to connect with people and form lasting relationships is with a handful of principles. At Starbucks, it's being knowledgeable involved, concern, and welcoming, and things of that nature. And these are things that they call 5 ways of being that they want all of their associates to demonstrate, not just to guests, but also to colleagues. And they don't prescribe how to do that, right? Use your own personal personality, read the situation, understand the needs of the circumstance. And we encourage you to find new ways to kind of demonstrate these 5 ways of being. We'll try to catch you in the act of doing one of them well, and we'll share those stories across the organization to inspire others and recognize all the ways that we do that. And it's that kind of empowered, personalized, principle-based approach is how you want to deliver the emotional, social, empathy, and compassion side. Not, it's very different than the medical, biological side of things.
So how does that work within healthcare? I'm playing devil's advocate here.
Sure,
People can
sure.
say, hey, this is great. Chick-fil-A, love their chicken sandwiches. Starbucks, love my caramel macchiato. But this is healthcare, and healthcare is very complex and it's very different. Talk about how some of those principles that work in those businesses have really translated and worked and been very effective within healthcare.
Yeah, well, the humans are the same, right? And whether it's the caregiver or the patient, we're all human, and so the wiring is all the same on both sides. And what we found is, one of the contributing factors is that there has become so much administrative burden placed on frontline caregivers, whether it's the documentation of electronic medical records or other types of forms or tasks that it might be, kind of Medicare related or what have you, that they are now reduced to a set of tasks that they are needing to run through. They can never keep up. They're kind of transactionally running through this. And as a result, the patient is feeling, kind of very uncared for. But even worse, the caregiver is not getting the emotional connection with another human and feeling some fulfillment and feedback that they're making a difference, that it's actually causing depression and burnout among caregivers as well. So it's like the worst of both possible worlds. So what we need to do is we need to streamline and revise processes. That's one of the things Starbucks and Chick-fil-A do very well. Part of the reason their people have the time to engage and connect personally is they've designed a process to be very efficient and make it very easy for people to get the task part of the job done and have the bandwidth to have a personal connection. So what we need to do is take that non-clinical administrative stuff off the plate of the frontline caregivers, give them the time to spend with a patient, to get to know them, to have some kind of emotional, social relationship building, what have you, and they'll both get out of that what they want that leads to better outcomes for both.
Understand that in principle. I know it's super difficult to do. Is there a tech component to this? Because there are oftentimes tasks that, or is that something that you guys are delivering or that you're helping facilitate with additional partners that you guys are connecting with?
Yeah, I think there can be technology components. Okay. There's a growing belief that a lot of the documentation of records may be able to be aided or speeded by technology going forward. In addition, it's possible to bring non-clinical staff. And in some cases, we've just heard at a recent conference, 3 different systems that are very innovatively using volunteers to do the non-clinical administrative stuff for caregivers, to take that off their plate, things related to beverages and blankets and questions and lost items and family members and all of that stuff that can free up time. And so I think it's requiring us to be innovative and say, hey, listen, we can't deliver care in the same way we did in the past. We got to streamline this and find a sustainable way to deliver care with the resources we have, because those missing people, they're not coming back next year. It's going to be probably a decade for us to kind of rebuild the stock of people we've left. So yes, I believe technology can be part of the way that does that. We are not personally so much involved in the technology aspect of it. Our firm is more about gathering insight, doing advanced analytics and predictive analytics, identifying opportunities, and guiding our clients to the right places to dig to solve problems.
So where are you getting that data from? Where are you pulling it from? And talk about that level, analysis and where you're generating those insights.
Sure. What we've brought is this new psychological, social perception model to healthcare. In academia, it's referred to as the warmth and competence model. It has been very widely shown to drive over 80% of human behavior in social context. And it's completely subconscious. We're not even aware that we're doing this, but we're basically in all of our interactions with other people, making judgments about what are the intentions of this person towards me and what is their ability to carry out those intentions. We call warmth is the intentions and competence is the ability. And we're kind of taught and trained in life that most of our success will come from our competence. However, the surprising thing that most people don't realize, that actually warmth is the dominant driver of our behavior because it was more predictive of survival and evolution. And so what we've done is identified specific measures of warmth and competence for patients to give feedback in those post-visit surveys, whether it's the CAP survey or other types of feedback, to ask them how they perceive the experience as well as how they perceive the provider on these dimensions of warmth and competence that give a much more precise diagnostic as to here's where our gap is or here's what we need to do differently. And then we do an analysis of that data, both at the individual level, at the hospital level, at the unit level, things of that nature, and pinpoint where there are areas to improve on that. And in many cases, what the gap is on that empathy, compassion, emotional side of things, and we connect them with resources to provide training and interventions and things like our emergency department hospitality is an example of how that kind of warmth component was addressed in an emergency department situation.
So we've spoken a little bit about some of the wins, but you can't always be winning when you're innovating.
That's right.
Let's talk about some of the challenges, some of the friction that you've kind of come up against, even most recently. Where do you see the headwinds? What do they look like, and what are you doing to try to get around them?
Yeah, I would say that the challenge is in the willingness to change. Healthcare is notoriously complex, notoriously slow-moving at times, although there's sort of full credit for the remarkable things that got done so quickly during the pandemic. But I think there's a little bit of a tendency now to say, okay, now we're going to go back to the way things were in 2019. And I think that there really needs to be.
Are you seeing that now, where
people say we're going to get back to basics, right? Meaning we're going to go back to the way we did things before. We're going to focus on the fundamentals. The fundamentals, in my view, have to be rethought, frankly, that we've got to find much easier ways to get people scheduled, much easier ways to get medical records completed, much easier ways to get people through the process. Because the pain that they're in now is probably no worse than pain of change, right? In the past, too painful, too hard, too costly, too time consuming, or what have you. But they're going to be in pain for quite a while right now. So you might as well, get on with the medicine and the cure, and not putting off this, procedure any longer. So I think, more significant change in the way care is provided and taking more and more administrative stuff off of nurses and clinicians.
So the organizations that have taken that bold step to rethink and to reimagine these fundamentals, what have been some of the traits that you've seen amongst the leaders that made them want to bear that pain to get through?
Yeah. I would say one of the things I've seen is a willingness in organizations to empower people at the mid-level to implement change. And so in some organizations, you can't really get anything accomplished unless it goes all the way up the ladder and multiple sign-offs, and there's all kinds of organizational challenges associated with decisions getting made. Whereas in organizations like Mayo Clinic or Cleveland Clinic, who we have spoken to and learned a great deal from as well, they are doing things like in obstetrics, streamlining the number of appointments that a pregnant woman needs to have in order to get care. And so, if they're going to have their ultrasound and there's going to be a report and there's going to be a follow-up visit and all that, they do that all on the same day and kind of shrink down what might otherwise be 6 visits into like 2, essentially, simply by coordinating scheduling, right? And it's a much better experience for the patient. It's much less time consuming for the professionals. It requires 1/3 the amount of scheduling. And they just kind of initiated that, validated it, and start to scale it. Similarly with the Cleveland Clinic, they did things to speed through people through the emergency department and fast track them by changing processes and basically saying, how can we break this and rebuild it in a different way? Whereas most organizations that we have seen are not as open to delegating that kind of experimentation and change down to the mid-level.
Why aren't they as open? I mean, let's get real here.
Why? I would say, I think it's reflective of one of the things that I mentioned earlier, and that is that healthcare has not availed itself, in my experience, of the degree of leadership and management and culture and people engagement that is widely accepted as common practice in many other organizations, many technology organizations, as a matter of fact, and that they're kind of consistently behind the curve in the adoption of, the most effective leadership, culture, empowerment, change management practices. Admittedly, they are in a complex industry that's highly regulated, and they don't have unlimited financial resources. But with that said, still I think there are some who are much more innovative in their leadership and management than others.
Yeah, I find that there's a few reasons that people say no to
Hmm.
change.
Hmm.
And it's mainly, number one, to buy themselves more time,
Hmm.
or somehow they say no to create a space of feeling safe.
Hmm.
And I don't know, have you seen any additional reasons as to why, some of these leaders are apprehensive about making changes?
I think that they are uncertain. Many of them, healthcare is the only place they've ever been. They haven't seen it done differently elsewhere. The other thing that's remarkable is the degree to which, even within a particular health system, that leaders can be empowered in different hospital presidents, for example, empowered to do things entirely different from one another. Basically saying, hey, you have the latitude to do things the way you want, and as a result, there's no consistency, from one to another, and they may or may not figure it out successfully. And so, in that regard, I think there is more decentralized in some respects than I have seen in other industries.
Mm. So what else are you guys working on that you're really excited about from an innovation standpoint that you want to share with the audience?
Yeah, I would say, one of the big things that we are focused on is looking at the linkage between kind of warmth and competence perceptions, loyalty of both patients and caregivers, and on specific outcomes. So we were able to connect the dots and show, for instance, for every 1 point increase on warmth or competence on a 4-point scale, loyalty goes up by about 3/4 of a point. And that for every 1 point increase in loyalty, we see double-digit increases in visits and payments overall. However, the way that visit and payment increase is happening is it is happening from an increase in preventive care. That when people have a strong relationship with their provider, they're going to the medical practice for wellness visits. They're doing their procedures as outpatient procedures. They're involved in those care continuations. And we see significant decreases in visits to the emergency department and inpatient visits. And so it's one of those things that says not only do patients feel better and have a stronger relationship that keeps them engaged with care, but there are better clinical outcomes as well. And oh, by the way, that results in better financial outcomes for the system. And so it's exactly what you would want to see. And frankly, it's not that surprising to us because we have shown the same thing in higher education and retail and food service and business-to-business services and transportation, where we've had the opportunity to apply these insights in other industries over the last 10 years.
And we're starting to see more leaders coming into healthcare from outside of the industry. How do you see that shifting from an adoption standpoint of looking at new modalities and interventions?
Yeah, I would say there have been, pros and cons. And the things that we hear, for instance, are, those who have a medical background will say, the corporate people are coming in and they don't understand, and they're interfering with the way the care should be provided. On the other hand, those that are coming in from outside the industry are trying to bring, best practices from a technology standpoint, digital experience standpoint, measurement standpoint, planning standpoint, and so forth. But they're also sometimes bringing a very cost containment, type of mentality as well, which, in our work, we find that, the more you focus on the bottom line, the less bottom line you get. It's kind of like, the way that you get more bottom line is by taking care of your customers, taking care of your employees, and they're the ones that make sure that you get, more bottom line. So I've seen kind of pros and cons of what has come from corporate, depending on which, function you're looking at.
So you mentioned a couple of different health systems that you guys have gotten some affinity from and taken some best practices from. Are there any other ones that come to mind that you are thinking about or learning from at a distance or even up close and personal?
Yeah, I mean, this is not anything. There are many people who have recognized this, but I think the digital journey, of course, that is commonplace in all other walks of our life with mobile apps and gig driving and food ordering and all of that stuff. It has been surprising to me how long it takes for that stuff to get into healthcare, essentially, and it's making progress, and it will make things easier for everybody, not only for the patients, but I think some of the biggest pain points in terms of access and equity and things of that nature can be solved with technology if there can just be a focus on bringing that in. I know they're making progress, and that everyone agrees that it needs to happen, but it can't happen soon enough.
Yeah. So what's the best way for our community to kind of follow your work? Give a short plug in terms of how we can follow what you're doing next.
Sure. So, we are publishing and speaking at events. You can visit us at fideliumhealth.com or thehumanbrand.com if you're interested in kind of the underlying work around our book and kind of human loyalty and trust, basically. Both of those are great resources where we have lots of articles, lots of case examples, lots of evidence. And we are fortunate to have had a number of academic papers published in our work. Our first paper was in 2012. Since then, there have been over 600 other peer-reviewed papers citing our work and expanding it in a number of different directions. So there's really a wealth of knowledge out there in academia on warmth and competence, but lots of opportunity to apply it more in healthcare.
So you've got a room full of senior leaders in front of you. Let's give you the magic wand. What do you need to say to them in order for them to have them really think about making change? What is the one thing that if you could just have them do one thing, what's the one thing that you would have them do? How might we be able to move things forward?
Yeah. I would say I would boil it down to the thing that they should have as their primary KPI is in building lasting relationships with patients and with caregivers, and between the two, essentially. And that in every industry we've done work in, even those that you would say by definition are transactional, or you never even meet the people who make the product or service, right? It turns out the way our brains are wired, we still need to fill in the gaps, and then we are having a relational orientation. And if we don't meet them, we are kind of filling in the blanks with what do we think we know about those people that made this? What can we infer from their advertising or experience, what have you? So especially in healthcare, where it's still so face-to-face, it's all about relationships. And it's a relationship with the caregivers so they feel empowered and have the resources they need so they can kind of stay engaged in their work and then make those connections with patients. Everything in commerce, in our experience, is ultimately driven by relationships. Every time we measure the relationship, we can tie it directly to the financial outcomes, the clinical outcomes, you name it. And so that's where I would say that needs to be on your KPI dashboard, essentially, because it's what's driving everything.
I remember a story of a really great leader in healthcare, and his assistant would often place time on his calendar. They call it MBWA, manage by walking around. And this leader would take that time to find out about people and their families. They'd walk the different floors and interact with different clinicians. And even though it was a very small thing, my gosh, it built an enormous amount of relationship equity with the team. And he would oftentimes quiz people and say, hey, what are our values? What are our values? When people would sort of recite the values, he would even take like $20 out of his pocket and be like, hey, this person's walking around, he's giving out money, so make sure you know the values.
That's right.
So it's just little things mean big things.
That's absolutely right. Little things make a huge difference. And in lots of great little success stories we've heard, it's not the loyalty program or the promotion or the app so much. It's the little gestures of kindness towards one another that have the biggest impact on each other.
Any final thoughts you want to share with the community prior to us signing off here?
Sure. The last thing I'll share is something that we use as kind of a guiding principle in everything we do, and I think it's applicable in virtually every walk of life, and that's what we call the principle of worthy intentions. And the idea of principle of worthy intentions is that we put the best interest of the other person ahead of our own in the short term so that we can earn more trust and loyalty and support back in the medium and long term. And it doesn't require us to recklessly disregard our own self-interest, but rather it's a form of enlightened self-interest that we get far more back if we put others first. And it's demonstrating that, you know, our intentions towards the other person are worthy of their trust and loyalty. It's the little things that we do that demonstrate that. And that, I think, can be, you know, a rule of thumb for all of us.
Chris, I think there's a reason as to why you and I hit it off really well. I think it's because a lot of our values are very much in line. So for those of you that joined in today, if you found the content helpful for you, would you mind sharing it on social media? Would you mind even just giving it a like or commenting or even giving us feedback in terms of other types of things that you would like to see from us? I'm grateful when we just even have a community of folks that are not just people that talk about innovation, they're doers. And I think that's what we need to have more of in order for things and for change to happen. So Chris, it's been wonderful to have you here, and I'm looking forward to having you come on again at some point in the near future. Open invite for you to share more stories and more insights. Thanks again. Look forward to our next chat.
Pleasure to be with you. Thank you, Michael.